Welcome back. We have today with us Dr. Vincent Rizzov. He's the chairman of internal medicine program at Queen's Hospital Center, Mount Sinai. Dr. Vincent is associate professor of internal medicine at Mount Sinai Medical Center, Mount Sinai Hospital. So today we're going to know more about the residency and about the interview. So I will ask Dr. Rizzov to please tell us something about your program.
So we have a program that consists of 74 residents. We've been sponsored by the Icahn School of Medicine for almost 30 years now. Over the past 15 years, we've expanded by 50%, from roughly 50 residents to about 75. We train people comprehensively in internal medicine, inpatient and outpatient medicine. We have a very diverse group of graduates who go into all different academic fellowships, or hospital medicine, or outpatient medicine. We've been very successful matching residents into fellowships. We matched 3 residents into university cardiology programs last year. We matched a resident into renal fellowship at NYU, a renal fellowship at Mass General, Hem-Onc fellowship at Mayo Clinic, multiple critical care fellowships at Ivy League institutions. So we do very well here. We're a very competitive residency process.
Yes. So Dr. Rizzov, would you tell us something about give us some tips about how to be successful to apply for residency programs in the United States, and what are something you see that a candidate can improve, and what are the things they should do when coming here in the United States, and for example, getting clinical experience. Is it important or not important? Please.
So clinical experience is always important, but I would say one of the first things to get your application to make it stand out is obviously test scores.
Test scores.
So test scores are generally the first thing that most people look at, because a low test score would almost always exclude somebody.
Right.
So we look at test scores first, and attempts if people don't pass.
Okay.
That's also considered. After that, really once you get into the door, or your application then gets looked at, clinical experience is very important.
Okay.
Especially for someone who didn't do clerkships in this country.
Okay.
One of the most important things that we look for is if someone has experience using an electronic medical record.
Oh, very nice.
Yes, because if you've never used an electronic medical record, starting intern year will be very difficult.
Yes.
If you're from overseas and you come into PGY1 and you're now practicing in a new country, which you've never practiced before, sometimes it's a brand new role, you've never practiced as a physician before, and you have to get used to a new entire healthcare system.
Correct.
And on top of that, if you've never used an electronic medical record, the learning curve is so much harder.
Right.
And we found in our experience that those candidates actually had a much harder time in PGY 1 year if they never had experience using EMR.
So they should be getting experience. Not only that, but they should be familiarized with every EMR they encounter in their rotations in the United States, or clinical observerships.
Yes. So I know not everyone gets to do clerkships in the United States,
Yeah.
but even if you're doing an observership, I would get familiar with the EMR
Yeah.
so that you could speak to it.
So I will add something on it. Epic EMR is now is in many centers.
It's
And
the largest in the world.
yes, it's the largest in the world. So I think if you get Epic, on your under your command, that will improve your chances. And they should write down in their letter of recommendation that they have this EMR experience.
It doesn't have, in the letter of recommendation, it's hard to control because they're not writing it.
Right.
But if, say I am a prospective candidate and I did an observership with you, I could ask you if you write me an LOR, and in that LOR, please indicate that I used Epic with you.
Okay.
If that's not possible, there are plenty of other fields in the RS, the application system,
Right.
where you could put information about yourself.
Okay, that also can be in the Rizzov application. Okay, Dr. Rizzov, other than that, what else you think? So I know the clinical scores, attends clinical experience, but especially now those days EMR is a very wide variety, and they have to learn the US system as well as the EMR.
Right.
So getting intern in without experience, it will be very difficult for them to adjust themselves. So it's important to have those experience. What other things we look to improve our chances in residency?
Training. So if you've had any independent activities, whether you worked as a house officer, whether you worked as a primary care physician, if you've done any advanced training before you come here, highlight that. And highlight your autonomy and independence. Because if you could show us that you've independently taken care of patients in your previous career, that would help your chances on a residency application.
Okay. Any other thing you remember?
Yes. So a lot of times when people come here from other countries, they don't get the opportunity to practice as a physician. They might have to do other jobs to make ends meet or
Right.
things like that. And although unfortunate and you have to do what you need to do, you should also stay clinically relevant.
Exactly.
If I look at someone who's coming from overseas and they graduated 5 or more years ago, I look for recent clinical experience.
Okay.
Because if it's been 5 years and you haven't worked clinically at all, I am skeptical about how easy it will be to transition back into clinical medicine.
That makes sense. You maybe not, you applying, you didn't get the residency, second year you are, so your resume should show no blank in clinical activities, and you genuinely work on it and stay relevant, like Dr. Rizzov says, that you continue have a medical education, for example, continue have a US clinical experience, no matter if it's even 2 days in a week. You can do 4 days work, but 2 days a week is enough to have, continue medical education, so you remain relevant.
Let me just piggyback on what you said. Absolutely, just 2 days a week is relevant. Because not only there shows that you're staying clinically active, but as a program director and as a chair of medicine, I want to see residents who are passionate about taking care of patients. And I want trainees who love the practice of medicine. And that's what I look for. And so if you are trained as a physician and you go 5, 6, 7 years without seeing a patient, that does not convey your passion.
Exactly.
But if you're working a job full time to support your family and still on nights and weekends you're working to see patients, that gives me a totally different message.
Exactly.
And that's the kind of person that I'm looking for.
Right, that shows different perspective, and so don't get disheartened. If you don't get first time, second cycle you applying, but remain clinically active. Show your patient. It should show in your application, and also it's good for you yourself too. So that's a very good point, Dr. Rizzov. That's a very good point. Any other point you want to mention?
Communication skills,
Communication.
both written and verbal.
Okay.
A lot of times now in this country, our patients ask a lot of questions.
Right.
And healthcare information is relatively on the third grade reading level. And we have to be able to synthesize complex information and break it down to a lower level for our patients. if you don't have good communication skills, you can't do that.
Right.
And if the patient doesn't understand, they're not going to listen.
For example, if you give us example that in the communication skill, I went to the patient and I'm a foreign grad. Went to the patient and patient asked me, doc, what problem I have? So if I'm not able to tell patient in a layman simple language, the patient won't understand, and that will create dissatisfaction. That's what.
It will create dissatisfaction, but not only that, the patient won't listen.
Exactly.
The patient, if you can't explain to a patient why they need fluid restriction for their heart failure, they're not going to restrict their fluid because their natural drive is to drink.